this week is job satisfaction. So with us here today we have three guests, namely Dr. Alicia, Mr. Faiz and Professor Pavitra. So let's start our talk show today. Dr. Alicia, as a medical doctor, would you like to give us a short introduction on your profession?
Okay, so my name is Dr. Alicia and I'm an orthopedic specialist in the General Hospital Kuala Lumpur. I've been working for 10 years and I got my first degree in University of Newcastle, UK and my postgraduate in University of Manchester. So basically, I'm an orthopedic specialist, so most complex cases resulting in like bone problems, spinal problems will be referred to me. So I will diagnose them by looking at the X-ray and I will also recommend the best treatment for them. Sometimes I will have to perform surgery on them, especially when the bones are out of alignment. For example, hallux valgus, where the bones at the feet is like this, so I have to align the bones back. And then other cases include scoliosis, where the spinal cord is in S shape, and also kyphosis, where the spinal cord is bent to the front, and lordosis, where the spinal cord is bent at the bottom of the spine, at the lumbar vertebra. So for other doctors, maybe medical officers or housemen, they have not been trained in orthopedic specialists. So if they would like to be an orthopedic specialist, they have to undergo 2 years in general surgery and also advance to about 4 or 5 years in orthopedic specialist section. Thank you.
Thank you, Dr. Alicia. That's very interesting. Okay, our second guest here, Mr. Faiz, is a lawyer. So, Mr. Faiz, would you like to tell us a little bit about your job?
Okay, thank you for inviting me, first of all. Okay, my name is Faiz. I have been working as a lawyer or as legal advisor in Skyworld Residences. So, my job basically as a financial lawyer. Okay, first I have to talk about my previous experiences in being a lawyer. Okay, I obtained my degree in Harvard Law School, and I've been working in US for about 2 years, and then I just got back from US to this country, Malaysia, my hometown, and I'm still working as a financial lawyer. And okay, basically, basic thing about my job, I usually handle property purchasing. Usually involve more than 1 million, and for example, like purchasing condominiums, apartments, maybe like land, something like that. I usually handle cases from banks also, such as suing, debt, something like that. Yeah, that's all.
Okay, thank you, Mr. Faiz. So our third guest, we have here Professor Pavitra. So Professor Pavitra, would you like to give us a short introduction on your profession as a...
Okay, thank you, Debbie. I'm Pavitra. I'm a pharmacology lecturer in University of Malaysia. I did my degree in University of Science Malaysia and continued my postgraduate in the UK. Right now, I'm teaching pharmacy students, which is undergraduate students, pharmacology, and doing my research in pharmacogenomics. So that's all about my profession. Thank you.
I don't think I've been this nervous with the cold drain in my suit.
Welcome back to ZigZagger Zika. Now let's proceed to segment 2, which is stress and time management. So Mr. Faiz, as a lawyer, I'm sure you face many difficulties in your everyday life. So how do you manage your time between your profession and your family?
Okay, now let us talk about what I did every day, almost every day, which is I already said before, to signing, right? Okay, signing is like a process in which lawyers and the client needs to sign the agreements, because the agreements the client have to sign in front of the lawyer. So that's why sometimes you have to travel a lot. So tiring, take lots of time, explaining the same things, about 3 clients a day, explaining the same things, which is sick me up, and sometimes it's a lot of stress from that. And the way I manage my stress and my time, it is actually like I have to keep it for a while And then maybe I can talk to my wife, maybe I can talk to my mother, maybe I can talk to my friends. What else can I do, right? So that's all. That's how I manage my stress.
Okay, thank you, Mr. Faiz. So, Dr. Alicia, generally we all know that many students, they are afraid to take up medical course because they think that the life of a doctor is very stressful. So, on that note, how would you like to comment about your stress and how do you manage your stress?
Okay, thank you very much, Levi. So, yes, medicine is very stressful because you have to study a lot and in such a short time. So, as a medical student, if you want to manage your stress, you have to know how to divide your time wisely. You cannot study last minute. And also, it will bring up to housemanship and also as a medical officer. You have to know how to manage your time wisely. So I would say that as a medical student and as a houseman, you'll be the most stressful time of your life. But as you proceed and go higher to medical officer and specialist, you'll be less stressful already. So what stresses different categories? For example, housemen, what stresses them is that they have to complete their training in such a short duration of time. 2 years is too short to learn so much things because medicine is such a wide field. And then they will be scolded by specialist doctors because they are not well trained and not competent enough. And of course, they will have to deal with patients who do not want to commit to them, who do not want to collaborate with them when they ask for patient history and clog the patients. The patients do not want to entertain them because they are housemen. So that is the major challenge for a houseman. And as for medical officer, the stress will come from managing the time between teaching medical students and housemen, and also treating the patients at the same time. So that's where the main stress comes from, because it's two different things: managing, coaching, training, and also treating patients. And as a specialist, the stress, there's not much stress, but the main stress is we have to be very careful in our area of specialty. Because, for example, as a surgeon, if I perform the surgery wrongly, then it might result in, like, for example, bones. If I cut the bones wrongly, I might get nerves. So maybe the patients would become critical and die. So I have to be very, very careful. Yeah, that's the main stress.
Okay, thank you, Dr. Alicia. So, Professor Pavitra, as we know, the job of a professor is as equally stressful as other jobs. So, what would you like to say on what kind of stress do you face and how do you manage your stress, especially from your students?
As for me, my stress is in terms of upgrading myself with new knowledges and skills, because my students now, they don't want a boring lecture. They want to use gadgets. They want virtual learning. So in my time, I don't have that kind of technologies, and it's a challenge for me to learn new things. But I still find it interesting because I'm learning new things as to teach, and since teaching is my passion, I love to learn new things just to teach them. So I don't feel that kind of stress compared to doctors or lawyers. So I enjoy my profession.
Okay, thank you, Professor Pavitra. Mr. Faiz, what do you like the most about your job as a lawyer?
Okay, about being a lawyer or as legal advisor. So my best part of my job is when, of course, about the salary is quite high and you can get about 15k per month. And the main, since law is my passion, so I don't have any trouble in managing my job. So that's the best part. When you love something, it is your passion, then you have nothing to argue with. I really love my job.
Thank you, Mr. Faiz. So, Dr. Alicia, is there anything that you don't like in your job, and if so, why?
Okay, thank you. So what I don't like about my job is the irregular working hours, because we have to be on call, maybe sometimes at night while we're sleeping, 3 a.m. in the morning, and suddenly someone calls you and said that, oh, we have a patient who is really, really critical, you have to come here now. So I have to wake up from my sleep and then rush to the hospital again. So that's what I don't like about my job.
Okay, thank you, Dr. Alicia. Professor Pavitra, what about you? What do you like the most about your job?
My job, I like teaching my undergraduate students because they are still very new to the course, and they ask me like very weird questions that I never have crossed before. So it's fun that they are curious and trying to know new things, and I enjoy teaching them.
Thank you, Professor.
And saying no thanks, like any way it goes, cause I know things they shouldn't have told me. Now I'm thinking what for.
Hi, good afternoon.
Good afternoon.
Yeah. How long have you been working as a nurse?
I have been working as a nurse for 5 years.
Okay. So, do you like your job?
Yes, I do.
So, from a scale of 1 to 10, how much would you rate your job satisfaction?
My job satisfaction is about, I would say 8.
8. Quite nice. So, what do you like most about your job?
You get to meet a lot of people, and there's different challenges to fix like different needs.
So, can you give some example about the challenges that you met before?
Let's see. For instance, sometimes because we have patients for pre and post operative, so sometimes we see things like patient different reactions to the anesthesia. Like certain patients, they don't wake up as easily, so things like that, or patient who have bleeding post operatively, and we know how to handle things.
So, most probably, how you handle about these challenges?
Yes.
So, how you handle it?
Usually we work together with the doctors and find the best solution. If it's unsolvable, usually we refer to other departments such as emergency team to solve the problems.
Seems like very interesting.
Yeah.
Yeah. So, do you have anything that you dislike about your job?
The only thing that I don't quite not to say I dislike, but the downside is usually being in a government hospital, you have to deal with a lot of patients, and sometimes you meet patients who are not very patient.
Yeah, I know.
So it's a bit of a challenge to deal and communicate well with the angry patients.
Do you feel like you are very busy to work as a nurse?
It's busy, but it's a good kind of busy.
Okay, so you really like your job.
Yes.
Okay, that's all.
Alright, thank you.
Shit, but I love yours. Fuck, I really.
Hello, sir. What are you working as?
I'm a retired teacher.
A retired teacher. I see. So, before this, what do you like about your job the most?
Oh, I teach children, I punish them.
You like punishing them?
No, actually it's a very rewarding job. And you see success in students.
So, from a scale of 1 to 10, how much do you rate your job satisfaction?
I would say maybe 8, 9, you know. Yeah.
Is there anything that you dislike about your job?
Not really, because some people say that the teaching job is very routine, but every year we have different students. Now our skill may be different, but students are different.
So before this, like, if you were given a chance to change your job, would you change to something else, or would you still be a teacher?
So far I haven't found something better than teaching.
So teaching is your passion from very young. Okay, that's all.
That's all. What is the name of the job?
It's called ZigZagger Zika. That's our TV magazine, and it's about job satisfaction.
Okay. Seriously, I make people rich. And that's what I like.
So on a scale of 1 to 10, how much would you rate yourself?
Because they're giving me a free trip on 26, I'm flying to Japan. Free trip. Everything fully paid.
So,
This, my flight, my hotel, my food, my travel around Japan, all free.
Nice.
How is it? Last year they sent me to Australia, Perth, Australia. Same thing. My flight, hotel, food, travel around Australia. Is it good?
Yes, it's good.
So surely I'll rate 10 lah.
So if you were given a chance to exchange your job for something else, what would it be?
I'll still be a consultant for public.
So what's the most challenging thing that you faced during your working years?
It's nothing challenging, but it's just that I see people, if they are not interested, I say thank you very much, because I feel that they lose, not me. Because they don't save money. If they don't save even $100 for themselves, when they get old, they don't become a millionaire. How would you like to save 100 ringgit today and become a millionaire in this lifetime itself by saving 100 every month? Is it good? Fantastic, right? Seriously, this is what I do. I make people a millionaire by saving 100. It's good, isn't it?
Yes. What's your name?
I'm Nurayini. Okay, what do you work as? I work as optometrist here at Focus Point.
So how long do you work here?
It's been 5 months.
So how do you like your job?
I like my job because this is what I really want to be, an optometrist. And I like the environment here, the team cooperation between my colleagues. Everyone always work hand in hand with me. And then I got a lot of opportunity to meet different types of customers than what I usually did during my university year.
Interesting. So from scale of 1 to 10, how do you rate your job?
8.
Then what does you like about your job?
What I like about my job, when I can give the best that I can to the customers. Like let's say they come with a problem of the eyesight, and I check the eye, and at the end I can give satisfaction to them. Then that's what I really like the most.
If you are given a chance to change a job, so and what job would you choose?
If I would do okay, I still want to be an optometrist, but maybe in a different field, like at the hospital, or maybe being a lecturer, something different, being a lecturer, but also in the optometry field.
Thank you so much for your time.
Brighter when you make me.
Now let's move on to our fourth segment, which is tips on choosing the appropriate course for you. So Dr. Alicia, as we all know, the SPM and SCPM results were just out, and students are now busy choosing their courses, like attending interviews for their selected courses. But there are still a few number of students who are unsure about their future and what they want to do. So what would you like to advise to students who are lost like that?
Okay, first of all, do not do medicine for the wrong reasons. You have to be very sure that it is your passion and you are really willing to sacrifice your life to commit your time for other people, especially your patients. And it means that you have to spend less time for your family and friends, but more time for your patients. So these students who wish to do medicine, they must know that they are willing to take up this challenge, to commit their time, and also they must work very hard, because medicine is a lifelong learning. They have to study hard and they have to learn a lot of skills in order to be competent as a medical doctor. So these students, they should be aware that there are many challenges in medicine, and the question is, are they willing to take up these challenges?
Okay, thank you, Dr. Alicia. So Mr. Faiz, what about you? What advice would you give to those students who are interested in pursuing law course?
Same as medical course, law also need passion, because you have to read a lot, you have to gain your communication skills, and your speaking must be very good. So for those students who are very interested in law, make sure you have all these skills, all these passions. Law is everything. Law is something that can guide people. So that means we have lots to study. That means law always updated. Every country has different laws sometimes. In Malaysia, compared to US, it is two different rules and regulations, or laws for short. To become a law student, you have to be patient and you have to have the skills in talking. So maybe you still have time to find it by yourself. And law takes lots of time and lots of practices, lot of chambering. You know, chambering is something like when you have to get a license to become a real lawyer. I mean, you have to do chambering and get the license so you can speak in the courtroom. So it takes lots of procedures, so you have to be very patient. And for me, I actually forced by my parents to take law foundations, and then I just figured it out that law is actually my passion. So that's why I love laws, and being a lawyer is my profession. So.
Okay, thank you, Mr. Faiz. So, Professor Pavitra, as a professor, I'm sure you deal with students every day and you understand their feelings better. So, what advice would you like to give to students who are about to choose a proper course in the future?
Thank you. In my experience, I have seen a lot of students, they are saying like after they have reached third year or second year, they're saying I don't really like this course. I'm taking this course because my family pressured me to take this course. So in my opinion, I think you have to think before you choose your course. Don't really choose a course because someone is pressuring on you, okay, take this course, you can earn a lot or whatever else. You ask yourself which course suits you, like what kind of skills you have and what interests you. I have seen students like some of the students they can't even see blood, but they are taking medicine courses. So really think before you choose a course and try to evaluate yourself what you can do and what you can't do. Don't seek advices from other people because they are not yourself. You have to ask yourself. So that's my advice.
Okay, now we have reached the final segment of our talk show, segment 5. So, Dr. Alicia, on a scale of 1 to 10, how much would you rate your job and why?
I rate my job 9 out of 10. It's because I truly have passion for my job and I love interacting with my patients, spending time with them and seeing them heal overall. So when they are healed, I feel very happy, so that is the main satisfaction of my job.
Okay, thank you, Dr. Alicia. How about you, Mr. Faiz?
For me, same as Dr. Alicia, I also rate 9 out of 10 because I really love my job and my parents seems like it and my wife also have nothing to argue with it. So I go slightly below because it's a little bit tiring. So.
How about you, Professor Pavitra? How much do you rate your job?
I would rate 10 out of 10 because it's really enjoying and while I'm teaching I could learn new things, so it's a really satisfying job for me. So why just leave one more mark for my job, so I'll just give 10 marks for my job.
Thank you, Dr. Alicia, Mr. Faiz and Professor Pavitra for joining us today on our talk show despite your busy schedules. Really appreciate you spending your time with us and talking about your job satisfaction. Okay, viewers, don't forget to stay tuned to the next feature of
ZigZagger Zika! Bye!